Occupational English Test. OET Answers Practice Test, Listening Test. This test has 3 parts. In each part, you'll hear a number of different extracts. At the start of each extract, you'll hear this sound. You'll have time to read the questions before you hear each extract, and you'll hear each extract once only. Complete your answers as you listen. At the end of the test, you'll have 2 minutes to check your answers. Part A. In this part of the test, you'll hear 2 different extracts. In each extract, a health professional is talking to a patient. For questions 1 to 24, complete the notes with information you hear. Now, look at the notes for Extract 1. Extract 1, questions 1 to 12. You hear a GP talking to a patient called Henderson. For questions 1 to 12, complete the notes with a word or short phrase. You now have 30 seconds to look at the notes.
Hi, Mr. Henderson. How are you feeling today?
Hello, Dr. Patel. I'm actually a bit concerned. My son Alex has developed this rash on his face. At first, I thought it was just a reaction to something, but now it seems to be spreading. He's not acting very sick, but I just want to make sure it's nothing serious.
I see. How long has Alex had the rash?
It started about 3 days ago. At first, it was just a bit of redness on his cheeks, almost like he had been slapped. But yesterday, I noticed it spreading to his arms and legs. It's not as bright on those areas, though.
That sounds like it could be fifth disease. It's quite common in children. Has Alex had any other symptoms, like a fever, or maybe a runny nose, before the rash appeared?
Yes, actually. About a week before the rash showed up, he had a mild fever. It wasn't too high, so I didn't think much of it. He seemed a little tired and had a runny nose, but I thought it was just a cold. Could that be related to this rash?
Yes, it's likely related. Fifth disease, or slap cheek syndrome, often starts with cold-like symptoms, fever, mild cough, or runny nose. After a few days, the distinctive red rash on the face appears, followed by the rash on other parts of the body, like the arms, legs, and sometimes the torso. The rash can come and go for a couple of weeks, especially if the child gets too warm or is out in the sun.
That's exactly what's happening. The redness gets worse when he's playing outside, but he doesn't seem too bothered by it.
That's good to hear. Fifth disease is usually mild in children and tends to resolve on its own without needing any specific treatment. The virus behind it is called parvovirus B19, and once Alex's body fights it off, he should be fine. In most cases, children recover without any lasting problems.
Oh, that's a relief. So, there's no need for medication? Do we need to stay home for a while?
There's no need for antibiotics, since this is caused by a virus. We usually focus on keeping the child comfortable. You can give Alex some paracetamol or ibuprofen if he seems uncomfortable, but it doesn't sound like he's in much pain. Make sure he stays hydrated and keep him out of the sun or excessive heat, as it can make the rash flare up. As for staying home, by the time the rash appears, children are no longer contagious. Fifth disease spreads before the rash develops during the cold-like phase. So, Alex can still go to school or daycare if he's feeling well enough.
Oh, I didn't realize that. I've been keeping him home because of the rash.
That's understandable. It looks alarming, but it's harmless at this stage. It's really during the incubation period, when they show cold symptoms, that they're contagious. But since the fever and runny nose have passed, he's no longer spreading the virus.
That's good to know. Is there anything I should watch out for, just in case?
In most cases, there's nothing to worry about. The rash might come and go, especially with changes in temperature, but it usually fades after 1 to 2 weeks. However, if Alex seems to develop joint pain, or if the rash persists for more than 3 weeks, it's a good idea to come back for a follow-up. Also, if he suddenly seems unwell, fatigued, or has trouble breathing, you should bring him in. These are rare, but it's good to be aware. If anyone in your family is pregnant or has a weakened immune system, let them know about Alex's illness. Fifth disease can cause complications in people with certain conditions, though this is also uncommon.
Oh, my sister is pregnant actually. Should I tell her?
Yes, it's best to let her know, especially if she hasn't had fifth disease before. Most adults have already been exposed to the virus and are immune, but pregnant women who aren't immune should be cautious. The virus can occasionally affect the unborn baby, so it's important for her to contact her healthcare provider for guidance.
I'll let her know. Thank you so much for explaining everything. I feel a lot better now. I was worried this might be something more serious.
You're welcome, Mr. Henderson. It's always best to check, especially with young children. If you notice anything unusual, or if the symptoms change, don't hesitate to come back. Otherwise, Alex should be back to normal soon.
That's great to hear. Thanks again, Doctor.
My pleasure. Take care, and I'll see you again if you have any more concerns.
Extract 2, questions 13 to 24. You hear a gastroenterologist talking to a patient called Mr. Harrison. For questions 13 to 24, complete the notes with a word or short phrase. You now have 30 seconds to look at the notes. Good afternoon, Mr. Harrison. How are you feeling today?
Afternoon, doctor. Well, to be honest, not great. My GP referred me to you because I've been having some issues with swallowing. It's been getting worse over the past few months.
I see. Can you describe the symptoms you're experiencing in more detail?
Sure. It started off as just a slight discomfort when I was eating, like the food was getting stuck in my throat or chest. At first, it was only with solid foods, but now it happens with liquids too. Sometimes I have to force myself to swallow again, and it feels like the food finally goes down, but it's really uncomfortable.
That sounds very frustrating. Have you noticed anything else, such as heartburn or regurgitation of food?
Yes, actually. I do get heartburn occasionally, but it's the regurgitation that's really bothering me. It's like the food comes back up after I eat, especially if I lie down too soon afterward. I've also started losing some weight because I'm avoiding eating as much as I used to. Eating has become more of a chore than something I enjoy.
I understand. Have you tried any treatments or remedies so far?
I've tried a few things. I switched to eating smaller meals more frequently throughout the day, and I avoid eating late at night. I've also tried drinking more water with my meals, but it hasn't really helped. I even cut out spicy foods and caffeine, thinking it might be acid reflux, but nothing's changed. My GP suggested trying a proton pump inhibitor, but that didn't make much of a difference either.
Thank you for sharing that. It sounds like you've been proactive in trying to manage this on your own. Based on what you've described, it's possible that you might be dealing with a condition called achalasia. It's a rare disorder that affects the esophagus, making it difficult for food and liquids to pass into the stomach because the muscles at the lower end of the esophagus don't relax properly.
Achalasia? I've never heard of that before. Is it serious?
It's understandable that you haven't heard of it. Achalasia is not very common. It can be serious if left untreated, but there are effective treatments available. The exact cause of achalasia isn't well understood, but it's thought to involve damage to the nerves in the esophagus. The most common symptoms are exactly what you've described: difficulty swallowing, regurgitation, and sometimes chest pain.
That sounds exactly like what I've been going through. What kind of treatments are available?
There are several options, depending on the severity of your symptoms and your overall health. One option is pneumatic dilation, where a balloon is used to stretch the lower esophageal sphincter. Another approach is a surgical procedure called a helemyotomy, where the muscles at the lower end of the esophagus are cut to allow food to pass more easily. There's also a less invasive treatment called pleural endoscopic myotomy, or POEM, which is similar to the helemyotomy, but is done using an endoscope. Medications like calcium channel blockers or nitrates can sometimes be used to relax the lower esophageal sphincter, but they are generally less effective for long-term management.
Those sound like serious treatments. Are they effective?
Yes, they can be very effective. The goal is to relieve your symptoms and improve your quality of life. The choice of treatment depends on various factors, including your age, overall health, and the severity of your condition. We would discuss the options in more detail after confirming the diagnosis. This usually involves tests like an esophageal manometry, which measures the pressure inside your esophagus, or an upper endoscopy to look at the esophagus directly.
It sounds like I have a lot to think about, but if it helps me get back to eating normally, I'm willing to do whatever it takes.
That's a good attitude to have. Achalasia can be challenging, but with the right treatment, most people experience significant improvement. We'll make sure to find the best approach for you. The first step is to confirm the diagnosis, and then we can discuss your treatment options in more detail.
Thanks, doctor. I appreciate your help. It's been a real relief just to talk about it with someone who understands.
You're welcome, Mr. Harrison. We are here to help you. Let's take things one step at a time and get you back to enjoying your meals again.
That is the end of Part A. Now look at Part B. Part B. In this part of the test, you'll hear 6 different extracts. In each extract, you'll hear people talking in a different healthcare setting. For questions 25 to 30, choose the answer A, B, or C, which fits best according to what you hear. You'll have time to read each question before you listen. Complete your answers as you listen. Now look at question 25. You hear a patient talking to a pharmacy assistant. Now read the question.
Hi, I need to refill my prescription, please.
Of course. Can I have your name and the medication you need refilled?
It's Stephen Thompson, and the medication is for my blood pressure.
Let me check. It looks like your usual medication is lisinopril. Do you need it urgently?
Yes, I'm almost out. I'm worried about missing a dose.
I understand. Unfortunately, we're currently out of lisinopril, but we can have it ready for you tomorrow morning. We do have an alternative, though, enalapril, which works similarly.
I'd prefer to stick with lisinopril since it's been working well for me. But do you think I'll be okay missing a dose tonight?
It's important to stay consistent, but missing one dose shouldn't cause immediate issues. Still, I recommend getting the refill tomorrow.
Okay, I'll come back in the morning.
Now look at question 26. You hear a medical professional explaining hand hygiene protocols. Now read the question.
You'll have seen the announcement about the new hand hygiene protocols that are being introduced next month. I'm sure you've considered how these changes might affect your routines, and it's completely understandable to have questions. There's no doubt that stricter hand hygiene practices can significantly reduce infection rates, which is why these updates are essential, but I recognize that implementing new procedures can seem overwhelming, especially with your already demanding workload. I want to reassure you that we've carefully designed the protocols to integrate seamlessly into your existing workflows. We'll be providing comprehensive training sessions to ensure everyone is familiar with the new steps, and we've placed additional hand sanitizing stations throughout the facility to make compliance as easy as possible. Supervisors will be closely monitoring the implementation to ensure that it doesn't interfere with your duties, allowing you to maintain your focus on patient care without added stress.
Now look at question 27. You hear a nurse talking to a colleague about a patient. Now read the question.
Today, we're going to focus on Mr. Thompson. He's 1 week post-surgery after having a pacemaker implanted. There was some mild swelling around the insertion site, but that's to be expected. This is his first follow-up since the surgery, right?
Yes, that's correct.
Okay, so today, we're going to start with gentle massage therapy around the incision area to help reduce the swelling and promote circulation. This should aid in the healing process and decrease any discomfort he might be feeling. We'll also monitor the site for any signs of infection. Over the next few sessions, you'll see how the treatment progresses to ensure proper healing and to prevent complications. The main objective is to manage the post-operative symptoms and support his overall recovery, allowing the pacemaker to function effectively without causing unnecessary strain on his heart or surrounding tissues.
Now look at question 28. You hear a physician talking to a nurse about Mr. Roberts. Now read the question.
It seems that Mr. Roberts is still a bit dizzy after his endoscopy. Is he showing any other symptoms?
Just some mild nausea, which is improving. I'm going to check his blood pressure before he's moved to the ward.
Good. I've placed additional orders for his post-op care. He has a history of heart disease, so we need to monitor him closely. There's a risk of arrhythmia due to the sedatives used during the procedure. I want his heart rate and rhythm checked every 4 hours. Also, keep an eye out for any signs of chest pain or shortness of breath.
Got it. I'll make sure the next team knows to monitor him for any cardiovascular issues.
Excellent. If you notice any irregularities or if his condition worsens, call me right away.
I'll be on alert.
Now look at question 29. You hear a nurse talking to a patient. Now read the question.
How are you doing today, Mr. Harris?
A little tired, but much better. The bandage feels snug, but there's no pain, so that's a relief.
That's good to hear. We've made sure the wound is clean and dressed properly. The stitches should heal nicely, but you'll need to come back in a week for a follow-up.
Thanks. I'm still amazed that I could get the stitches done so quickly. I remember when I had a similar cut a few years ago, I had to wait hours before getting treated.
Yes, advancements in triage and treatment have really improved wait times. Just make sure to keep the area dry and avoid heavy lifting until it heals.
I will. It's just surprising how efficient everything was this time. I was expecting a longer stay.
It's all about getting you back on your feet as quickly as possible.
Now look at question 30. You hear a physiotherapist talking to a group of patients about the importance of physical activity. Now, read the question.
It's essential to recognize that regular physical activity plays a pivotal role in recovery. It's not just about regaining strength, but also about improving flexibility, balance, and overall function. Unfortunately, some patients are hesitant to engage in exercises, fearing that it might worsen their condition. However, studies have shown that inactivity can actually delay recovery and increase the risk of complications, such as muscle atrophy or joint stiffness. Our clinic has seen a significant improvement in patient outcomes by encouraging consistent, tailored exercise routines. In fact, our recovery rates are above average, with 90% of our patients achieving their mobility goals, compared to around 75% nationally. To sustain these outcomes, we need to emphasize the importance of staying active, even when progress feels slow. The key is to start gently and gradually increase the intensity under professional guidance.
That is the end of Part B. Now look at Part C. Part C. In this part of the test, you'll hear two different extracts. In each extract, you'll hear health professionals talking about aspects of their work. For question 31 to 42, choose the answer A, B, or C, which fits best according to what you hear. Complete your answers as you listen. Extract 1. Questions 31 to 36. You hear a pediatric endocrinologist giving a detailed presentation on dwarfism. You now have 90 seconds to read questions.
Hello, my name's Dr. Sarah Mitchell. I'm a pediatric endocrinologist, and today I'm going to discuss a condition known as dwarfism. Dwarfism is a medical or genetic condition that results in an adult height of 4 feet 10 inches or shorter. There are over 200 different conditions that can cause dwarfism, but the most common type is achondroplasia. Achondroplasia accounts for about 70% of all cases and is characterized by short stature with disproportionately short arms and legs, a large head, and a prominent forehead. It's important to note that while the condition primarily affects bone growth, individuals with dwarfism can lead healthy and fulfilling lives. However, due to the condition's rarity, it's often misunderstood, and there can be significant misconceptions about its impact on physical and intellectual abilities. The cause of dwarfism varies depending on the type, but it generally results from genetic mutations. In the case of achondroplasia, it's caused by a mutation in the FGFR3 gene, which affects the development of bone and cartilage. This mutation can occur randomly, but it can also be inherited from one parent with the condition. It's crucial to clarify that most cases of dwarfism are not related to any preventable factors and that environmental, Influences during pregnancy, such as nutrition or lifestyle, do not cause the condition. Furthermore, people often wonder if dwarfism affects intellectual development, but in most cases, it does not. Individuals with dwarfism typically have normal intelligence and can achieve success in all areas of life. Let me share a recent case that highlights some of the challenges faced by individuals with dwarfism. A 10-year-old girl named Lily came to see me with her parents because they were concerned about her short stature compared to her peers. Lily had been healthy overall, but her growth had noticeably slowed down by the time she was 3 years old. After conducting a series of tests, including genetic analysis, we diagnosed her with achondroplasia. Lily's parents were initially worried about how this condition would affect her future, particularly in terms of her physical abilities and social life. We discussed the importance of early intervention, including physical therapy to help improve her strength and coordination, and how adaptive strategies could support her in daily activities. I reassured them that with proper support, Lily could live a fulfilling life, participate in most activities, and achieve her goals. When managing dwarfism, it's important to address both the physical and emotional challenges that patients may face. Research shows that children with dwarfism are at a higher risk of experiencing bullying and social isolation, which can lead to anxiety and depression. Therefore, it's essential for healthcare providers and families to work together to create a supportive environment that fosters self-esteem and resilience. For example, encouraging participation in activities where height is less of a factor, such as swimming or music, can help children develop confidence. Additionally, educating schools and communities about dwarfism can reduce misconceptions and promote inclusivity. Another case that illustrates the need for ongoing care is that of a 35-year-old man named Mark who has achondroplasia. Mark had been managing his condition well, but he recently began experiencing chronic back pain, a common issue for adults with dwarfism due to spinal stenosis, which is the narrowing of the spinal canal. This condition can compress the spinal cord, leading to pain and neurological symptoms. Mark had been hesitant to seek treatment because he feared it would interfere with his work. After discussing his concerns, we decided on a conservative approach, including physical therapy and pain management techniques, to help alleviate his symptoms while allowing him to continue working. This case highlights the importance of addressing both the medical and personal concerns of patients with dwarfism to ensure they can maintain their quality of life. When it comes to treatment for dwarfism, there's no cure, but there are various ways to manage the symptoms and complications associated with the condition. Early diagnosis is key to ensuring the best possible outcomes. For example, growth hormone therapy may be an option for certain types of dwarfism, although it is not effective for achondroplasia. Surgical procedures, such as limb lengthening, can be considered in some cases, but they are controversial and come with significant risks. More commonly, treatment focuses on managing symptoms, improving quality of life, and supporting independence. Patients often ask if they should follow a specific diet or lifestyle to manage their condition. While no special diet is required, maintaining a healthy weight is important, as obesity can exacerbate complications like joint problems and back pain. Additionally, regular exercise that focuses on strength and flexibility can be beneficial. It's also essential for patients to have regular checkups to monitor for potential complications, such as spinal issues or respiratory problems.
Extract 2. Questions 37 to 42. You hear a conversation between a interviewer and Dr. Emily Harper discussing her recent study on brucellosis. Now, read the questions. You now have 90 seconds to read questions.
Welcome to the show. Today, we have Dr. Emily Harper from Johns Hopkins University. Dr. Harper is here to share insights from her recent study on brucellosis, a zoonotic infection that has significant implications for both public health and the agricultural industry. Dr. Harper, thank you for joining us today.
Thank you for having me. I'm eager to discuss this important topic.
So, what was the main takeaway from your research on brucellosis?
The primary finding from our research is that brucellosis remains a significant public health issue, particularly in regions where livestock farming is prevalent. Despite efforts to control the disease, it continues to persist, largely due to the close interaction between humans and animals, especially in rural areas. Our study highlighted that while brucellosis is often underdiagnosed, it can lead to chronic health issues if not treated properly. We also found that public awareness of the disease is low, which contributes to delayed diagnoses and ongoing transmission.
That's concerning. What are the primary challenges in diagnosing and managing brucellosis?
One of the biggest challenges is the non-specific symptoms of brucellosis, which often resemble those of other febrile illnesses such as the flu. This can lead to misdiagnosis or delayed diagnosis. Additionally, there's a lack of awareness among both healthcare providers and the general public about the disease, particularly in areas where brucellosis is not commonly thought of. Another challenge is that brucellosis can become chronic if not treated promptly, leading to long-term complications such as arthritis, endocarditis, and neurological disorders. Effective management requires a combination of antibiotics over an extended period, which can be difficult for patients to adhere to, especially in regions with limited access to healthcare.
Given these challenges, how can healthcare providers improve the diagnosis and management of brucellosis?
Education and awareness are crucial. Healthcare providers, particularly those in endemic areas, need to be trained to recognize the symptoms of brucellosis and consider it in their differential diagnoses. Early diagnosis is key to preventing the chronic complications of the disease. We also recommend the use of more sensitive diagnostic tests, such as polymerase chain reaction PCR assays, which can detect the bacteria more accurately than traditional methods. Furthermore, public health campaigns should be aimed at educating the general public, particularly those in rural and agricultural communities, about the risks of brucellosis and the importance of seeking medical care if they experience symptoms.
What specific benefits did your study identify in terms of early diagnosis and treatment of brucellosis?
The most significant benefit of early diagnosis and treatment is the prevention of chronic disease. Patients who are diagnosed early and receive the appropriate antibiotic therapy are much less likely to develop the severe, long-term complications associated with chronic brucellosis. Our study also found that early treatment reduces the risk of transmission, particularly in households where other members are at risk of exposure. Additionally, patients who are treated early experience a faster recovery and a significantly lower recurrence rate. This highlights the importance of timely intervention, not only for individual health outcomes, but also for broader public health efforts to control the disease.
How have patients responded to the treatments for brucellosis, particularly in areas with limited healthcare access?
Patients generally respond well to the treatment regimen, which typically involves a combination of antibiotics like doxycycline and rifampin over a period of several weeks. However, adherence to the full course of treatment can be challenging, particularly in areas with limited healthcare access. Some patients find it difficult to continue the medication for the entire duration, especially when symptoms improve early on, leading to incomplete treatment and the risk of relapse. There's also the challenge of managing side effects from the antibiotics, which can sometimes be severe. To address these issues, healthcare providers need to offer strong support and follow-up care to ensure patients complete their treatment.
Were there any criticisms or areas for improvement identified in your research on brucellosis?
Yes, while the majority of feedback was positive, there were some areas for improvement. One major issue is the need for better surveillance systems to track cases of brucellosis more accurately. In many regions, the reporting of brucellosis cases is inconsistent, leading to gaps in data and an underestimation of the disease's true impact. Another area for improvement is the development of more effective vaccines for livestock, which would help reduce transmission to humans. Lastly, the study highlighted the importance of integrating brucellosis management into broader healthcare initiatives, particularly in rural areas where resources are limited. By doing so, we can ensure that brucellosis is addressed alongside other health priorities.
It's clear that there's still much work to be done to control brucellosis. What do you see as the next steps in combating this disease?
Moving forward, I believe the focus should be on strengthening both human and animal health systems. For humans, this means improving diagnostic capabilities, expanding access to treatment, and increasing awareness through public health campaigns. On the animal side, more effective vaccination programs and better livestock management practices are essential. Additionally, global collaboration is crucial. Brucellosis is not confined to one region, so international cooperation in research, surveillance, and control efforts is needed to reduce its impact worldwide. Finally, continued research into new diagnostic tools, treatments, and vaccines will be vital in overcoming the challenges we face in controlling brucellosis.
Thank you, Dr. Harper, for sharing your expertise. It's clear that brucellosis is a complex issue, but your insights have provided a better understanding of the disease and how it can be managed.
Thank you for having me. I'm glad to have had the opportunity to discuss this important topic.
That is the end of Part C. You now have 2 minutes to check your answers.